Hi, knock knock. Hi, just finished washing my hands. Hi, my name's Brianna. I'm the nurse practitioner today. How are you?
I'm doing fine.
Good. What's your name?
Glenda,
Glenda. Hi, Glenda. How old are you?
63,
63. Okay. And do you identify as a male or a female?
female,
Female. And what's your ethnicity?
African, Black American.
African. Okay. Thank you. What brings you into the office today?
I've been having a problem with my knee.
With your knee? Oh, your right
My-
knee?
Yeah, my right knee.
Okay. When did this all start?
About a week ago.
About a week ago?
Well, I think it been bothering me for about a couple weeks.
Okay.
And then I had a problem because I had fell in the bathroom and then it's just started back hurting me.
Okay. Where at on your knee? Point to it. Where it's
Right
at.
here.
On the right side? On the
Yep.
right side of the right knee.
Yeah.
Okay. And so it's been going on for about 2 weeks or
Yeah.
longer? Because you said you fell in the bathroom.
Yeah, I fell back in October when I was on some medication. Then I wound up in the hospital with my blood pressure. And they changed my medicine. And now I'm having a problem with my knee.
Richard, okay. How would you describe the pain? Is it like an aching pain, a dull pain?
I can say it's about a 6.
It's a 6 out of 10.
Yeah.
Well, that's pretty painful. I'm so sorry to hear about that.
Yeah, I'm trying to see what I can do about it.
How would you? Is it like a dull pain or like a sharp pain? Pins and needles.
It's sharp pains every now and then.
Sharp pains.
Yeah, because when I bend it, it really hurts. Then I have to pop it out because it pops every now and then. And that hurts.
Ooh. So what makes it worse?
It just depends how I bend my knee.
Okay, when you bend it, it makes it worse.
Yeah.
Is there anything that makes it better?
No, not really, unless I rub it out sometimes.
Do you take any medicines for it?
Uh-uh.
No? Do you notice that it gets like worse during the day or at night?
I think
or
it hurts when it rains.
when it rains?
Yeah, it
Yeah.
aches.
Okay. And have you noticed any other symptoms with it besides the pain? Like any like tightness in the knee or maybe like muscle spasms?
No, not really. It throbs every now and then.
Throbbing as well? Okay. So yeah, what do you think happened? It sounds like you said that when you fell in the bathroom, it caused the knee to get injured.
Yeah, because like when I get ready to go to bed at night, I try not to bend it. Because when I bend it, like getting in the bed,
Yeah.
it pops. And then I have to pop it right back out. It's kind of strange, but that's what's happening sometimes. So it pops every now and then. Not all the time, but it pops every now and then. Yeah.
Okay. Wow. So sorry to hear about that. Sounds painful.
It is. And I think it'd be painful more when it rains and damp outside.
Okay. What? When have you ever been hospitalized?
Oh, yeah. I've been in there for a couple of hernia operations. I had a hysterectomy done. Be in there a lot, in and out for my blood pressure, high blood pressure.
Have you ever been hospitalized for the injuries? Any injuries before?
Oh,
Okay.
no.
Okay. What about any illnesses?
No, just high blood pressure.
Okay. So let's move on to your family history. So does any of your siblings, your mom or dad, or any of your other direct relatives have a history of asthma?
No.
Okay. What about diabetes?
Yeah.
Yeah. Who has diabetes in your
My
family?
older brother.
Your older brother.
And he go on dialysis 3 times out the week now.
And that's on your mom or your dad's side?
My mom.
Okay. What about cancer?
That's one of my family too.
That does. Okay. Who has cancer in your family?
My sister.
Your sister on your
Mom.
Okay, yeah. Well, okay. And then what about so cardiac disease and hypertension?
Everybody in my family got that.
Okay, both sides.
Yeah.
Okay. And okay, good to know. So we're gonna move on to your psychosocial history. What do you do for a living?
I just retired.
Congratulations.
Thank you.
How long have you been retired for?
It'll be a year in June this year.
Oh, wow. Excellent. Do you have any children?
I have one wonderful son, and he's married and waiting on a grandbaby if I ever get one.
Okay. Um, where do you live?
Ypsilanti
Do you live in an apartment or a house?
apartment.
Okay. And do you have a good support system at home
Mm, yeah,
with your family and friends?
yeah.
Okay. Have you been going through any stressors lately?
No, not really.
Not really.
Mm-mm.
Okay. All right. Now we're gonna move on to the woman's health part. Are you sexually active?
Most of the time, I try to get my exercise, getting out, going to the laundromat, going to the grocery store.
No, sexually active.
Oh no,
No. Okay. Um, have you ever had any sexually transmitted diseases?
no,
Okay. Are you taking birth control?
no.
Okay. Have you ever? How many times have you been pregnant before?
Just once.
Okay. All right. And are you having a menstrual cycle?
No,
Okay. No more. Your menopause.
no,
Okay. All right. Now let's move on to your current history. Do you have any medication allergies?
mm-mm.
No. Any like seasonal allergies? Like no allergies. Food allergies?
No,
Okay. Do you take any medications?
no,
No. Okay. Do you smoke tobacco? Chew
No.
tobacco?
no,
Okay. Do you take any supplements?
no,
Any recreational drugs?
no.
Any alcohol use?
Every now and then,
Okay. How often?
maybe twice out the week.
Okay. And what about flu shot? Did you get your flu shot last season?
I think I did. Yeah.
Okay. And what about the COVID shot? Did you get that one?
No, not yet. but
Okay.
I'm working on it.
Okay. And what kind of diet do you have? Do you have a good diet with meat and vegetables?
Mm-hmm.
Okay. And do you drink coffee? Caffeine?
Yes.
Okay. How much caffeine do you have?
Yeah. Just 2 cups a day.
2 cups a day? Okay. Now exercise. What kind of exercise do you do?
Going to the grocery store, going to the laundromat, washing my car, riding my bike, trying to stay in shape.
And how often do you do that?
Well, it just depends how the weather is outside. I can ride my bike.
Yeah.
You know, the weather's getting nice, so I can ride my bike.
That's nice.
That's my retirement bike.
How many hours of sleep do you get every day?
It just depends. You know, since I retired, I sleep wacky, crazy now. I sleep off and on, like stay up late, watch TV, go to bed 2 or 3, go back to sleep. This is back from 4.
Okay. So like on average, how many hours if you had to
I'd
guess?
say about 6.
6 hours. Okay. Okay. All right. Now we're gonna just move on just to just a quick overview of like overall how your body's been.
Mm-hmm.
Have you noticed like any overall weakness or tremors or
No.
nothing like that? How's your skin been? Any dryness or rashes?
Well, I have dry skin.
Dry skin.
Yeah.
Any sores on your skin? Okay. For your head, have you had any headaches or vision changes?
My left eye kind of changed because I had cataracts, so right eye is better than the left eye. But I think I'm gonna get some more glasses.
Oh, okay. Okay. So you got an appointment coming up here soon?
Yeah, I gotta make another appointment. I missed the last one.
Okay. Any issues at all with your breasts or any changes? How's your breathing been? Any shortness of breath?
No, good.
Yeah. Okay. No issues with like chest pain.
No.
Okay. How about your heart? Like fast heart rate or palpitations?
Sometimes I have heart rate fast. Sometimes I have to sit up. I don't know where it's coming from, but I do have it every now and then.
Okay, every now. How often does that happen?
Maybe twice out the week.
Okay.
You know how your heart, you race it sometimes. I can be laying in the bed, it beat real fast, so I sit up. Cause
Oh.
like it scare me, then I lay back down.
Okay. Any issues with your like urinating or urine too much or not enough?
I pee constantly because I drink water all day.
Good. Good. And any issues with like your private areas, itchiness, rashes, anything. For your muscles, have you noticed any like changes in your joints or any like stiffness
Mm-mm.
with your joints? Um, for your neural status, have you noticed any like? Do you ever get like confused or forgetful?
Sometimes.
Really?
Yeah.
Okay. Just forget and stuff like your
Like if I
keys,
go in my
simple stuff.
room, like if I go in my room, I like if I come from the kitchen or the dining room and I go in my bedroom, I say, "What I come in here for?" You know, I put my
Hmm.
hand up there like, "Oh, now I remember."
Okay.
Yeah.
Okay. And for your like, have you noticed any issues with like bleeding too easily or bruising easily?
Yeah, I bruise easy all the time. I
Really?
bump into a table or something, I get a bruise. Next day, I say, "Where I get this bruise from?"
Really?
Yeah, so I'm easy to
Mm.
get bruised if I bump against anything.
Okay. For your endocrine, have you noticed any like cravings? Do you crave a lot of sugars or
Mm-mm.
sweating?
I
Sweating.
have a lot of night sweats. That's why I'm trying to figure out why I have these night sweats. And then I'll be trying to ask the doctor, can I get something? They don't want to give you too much or nothing when you got high blood pressure.
Okay. Yeah, yeah. Don't want to interact with that
Because
with
sometimes
meds.
my whole bed be wet, soaking
Wow.
wet.
Every night or?
You just, some nights, if I have night sweats,
Mm-hmm.
the pillowcase be wet,
Wow.
the sheets be wet. I have to move over some because then because I don't want to get no cold or nothing.
Yeah. Wow. How long has that been going on?
For a long time.
A long time.
Yeah, I gotta figure out what I can do about it. Cause now summertime coming, then now these hot night sweats. Oh no.
Yeah, yeah. It's gonna be hot. Have you noticed any anxiety or depression?
Mm-mm.
No. Your mood been okay?
Yeah.
Okay. All right. So now we're gonna move on to the neurological part of our exam. Okay. So I'm gonna wash my hands again. All right. So the first part of the exam is noting her general appearance. So she has a nice erect posture and she's balanced well while she's sitting. So first, I'm gonna check her olfactory cranial nerve. So in order to do that, we're gonna check smell on each nostril. Okay. So what I'm gonna have you do is like cover up one nostril and then smell this, and you tell me what it smells like, and then cover up the other nostril, smell this one, and tell me what this one smells like. Okay.
Mm-hmm.
Okay. So cover up one nostril and then smell it.
I don't know what it smells like.
It's tangerine.
Is it?
Like an orange. It kind of smell like an orange a little bit.
Yeah.
Okay, yeah. All right. All right, try the other one. Nostril. This one. If you got the guess, this is kind of like a
Oh,
blue.
that smells like peppermint or spearmint.
Yeah, yeah.
Yeah.
Okay, cool. All right, cool. So her olfactory nerve is intact and she can smell um, equally from both nostrils. Okay, now we're going to move on to your optic nerve. I have a piece of paper here for you, and are you able to read this sentence off of this paper?
Yeah, the weather outside is, what is it, raining?
Yep. Okay. So she's able to read this sentence off of the paper. So her ocular nerve is intact. Okay, so next I'm gonna check your visual fields. And in order to do that, I'm just gonna have you look into my eyes, right? Here, come this way, like you stand right in front of me.
Okay.
Okay, I probably should come in front of you so we can be on the same level. It'll be better that way. Oop. Okay. So look at my nose. Okay. Look at my nose. All right. Let me know when you see this finger wiggling.
I see it.
I see. Okay. Good. All right. Let me know when you see it.
I see it.
Good. And do the same on this side.
I see it.
Good. Okay.
I see it.
All right. All four of her visual fields are intact. She was able to see my finger on assessment. All right. Next, we're going to move on to your ocular motor. I think I brought my pen light. I didn't bring my pen light. Do you have a flashlight?
Mm,
Don't worry about it. But in order to check her ocular motor nerve, what I would do is take a pen light and like look at her pupils, and I can see her pupils a little bit, and they are intact, and they're equal and reactive to light. So now we're gonna move on to her ocular motor nerve. So what you're gonna do is look at my nose. No, not look at my nose. You're gonna look at my finger without moving your head. Okay. So follow my finger without moving your head. Okay. All right. Ready? Okay. Good. So the movement of her eyes was even, and there were no fasciculations of her eyes. So her ocular motor nerve is intact and working properly. All right, now we're gonna move on to the trigeminal nerve. Okay, so what I'm gonna do, I'm gonna put my hands on the side of your here it is, on the side of your head right here, and then on your masticator muscles right here on your cheeks, and just like chew just a few times. I'm just checking to see how strong they are. Okay, good. Chew a few times. Can you chew? There you go. Good. Do it again. Good. Yep. So, yeah, on palpation, I was able to feel her masticator muscles, and they are strong and equal on both sides. All right, so next we are going to move on to the light touch part of the exam. And do you have like a little cotton swab or like a tissue? Oh, I'll just get a
I
tissue.
got some Q-tips. I mean,
Yeah,
yeah. My
Q-tip
ear
in
is in
here.
the bathroom,
Okay.
and the light. Turn the light on.
Okay.
You see it in the closet shelf.
Yes. Okay. So for this part of the exam, I'm just assessing to see whether or not you can feel like really light touch. So close your eyes, and when I touch you, let me know when you feel it, okay?
Mm-hmm. I feel it. Feel it. Feel it.
Mm-hmm.
Feel it. Feel it.
All right. Yep. So her light touch sensation is all intact, and she's able to feel light touch in all quadrants of her face. Okay. So next, I'm moving on to cranial nerve 7. Go ahead and raise your eyebrows. Like that. Good. Can you frown? Good. Close your eyes. Show your teeth. Good. And puff your cheeks out. Good. So yeah, her facial cranial nerve number 7 is intact. All of the like movements were symmetrical, and so her cranial nerve 7 is intact as well. So now we're going to move on to cranial nerve 8, and that is the glossopharyngeal, and then the vagal nerve. So first, in order to assess that, I would just just listening to her voice quality during the entire time of the assessment, and it's very articulate. It's clear. So also too, I'm gonna have her say ah, and then look at her soft palate, and then also look at her pharynx movement. So can you say ah?
Uh-huh.
Yeah. Okay. Her pharynx moves appropriately. All right, so next we're going to move on to cranial nerve 11, and that one's the spinal accessory nerves. So she's just going to like shrug her shoulders, and I'm just going to see if she's able to, do that against a little bit of resistance. And then I'll place my hands on both sides of her cheek and have her turn her head against the resistance. So can you do a nice shrug? Good. Okay, turn your head against my, here we go. Same on the other side. Good. So yep, cranial nerve 9 is intact. For 11, that one's looking for the tongue. So what I'll have her do is like stick her tongue out and have her move her tongue back and forth, and looking for like any fasciculations or any abnormal movements noted. So can you stick your tongue out? I'm like that. Awesome. Yep. So her cranial nerve or her hypoglossal cranial nerve is intact. No fasciculations. Her tongue was able to move evenly. All right. So next we're going to move on to coordination. The first one is to have her touch her thighs. You can go like this as fast as you can. Good. She was able to do it. And then next you're going to touch your nose and touch my finger as fast as you can. Keep going. Okay. I'm doing the other side. All right. Good. So her coordination is appropriate and it's intact as well. And it's equal bilaterally. Next, we're going to go to her lower extremities. And in order to do that, I'm just going to ask her to tap her feet back and forth like that as fast as she can. Yep, she's able to do it. And then also I'm going to have her rub her heel going down her shin and back up and see if she can do that bilaterally. So I can show you with the camera too. All right, so tap your feet first. I don't think they saw that one. On both feet. Do the other feet. There you go. Okay, then next, do your shin. So you're gonna move your shin down your heel down your shin.
Like this?
Like this. Yep. And you're gonna do the other one the same way. All the way up to the. There you go. Awesome. So yep. Her coordination is good. Bilaterally, upper and lower extremities. Okay, so next what we're gonna do, I'm gonna have her do a tandem walk. And all you have to do is you're just gonna walk right here and then walk back to me. And what I'm looking for is the swing of her arms, making sure that her gait is even. And then you're gonna walk heel to toe, kind of like you're doing like a sobriety test. It'd probably be better to do it here. It's a little bit more room over here. Okay. Move this out the way. Let me get the camera on you first. Okay, so you're gonna walk, and then walk toward me. So we're noting the swinging of her arms. Okay, and I'll go back and you're gonna walk heel to toe. Heel to toe, like you like you're doing a test when they test how you drunk.
Right down here?
No, like this.
Oh.
Yeah, like that. Okay, do it one more time toward the bike. There you go. Coordination. All right. Coordination. Yeah, no. None of that over here.
Off balance.
Okay. So yeah, her coordination, the swing of her arms was appropriate. They alternated according to the legs that she was stepping on at the time, and also she was able to maintain her balance while she was doing the heel to toe assessment. Okay, so next what we're gonna do is, what I need you to do is hop in place, just like for a few times. You could go like this, or you can hop, whichever.
Okay.
Is it that you like? Good. Okay. So, yep, she's able to do that. She's able to hop in place. Next, what we're going to do is I'm going to have you stand for about 30 seconds. So, yep. And then close your eyes. Okay, now put your arms out. Okay, good. So that's checking for pronator drift as well, and she was able to maintain her balance. That's what we're looking for that test. Even with her eyes closed, she didn't fall or stumble. All right, so next we're going to move on to the motor system. I'm observing her body position at rest. So, yep, she's erect. Her posture is intact. I don't notice any tremors or ticks or fasciculations anywhere on her body. I'm inspecting her muscle size. It's bilateral, and also there's no muscle atrophy, and the size is appropriate for her weight and her height. Um, Especially looking like at the shoulders and the arms and the thighs. So now we're gonna move on to her muscle strength. Um, so in order for me to test her elbow strength, we'll have her like you're gonna do like this, and I'm gonna apply a little bit of pressure. Don't let me move you, okay? Good. Don't let me move you. Don't let me move you. Fight me. Okay. Try again. Go like this. Okay. Don't let me pull you. Don't let me push you. There we go. So she's very strong. I would grade her muscle strength a full strength of 5 out of 5. Now we're gonna move on to her wrist strength. You're gonna do your wrist. You're gonna make a fist. Okay, I'm gonna try and pull him down. Don't let me pull him down. Good. Don't let me push him in either. Okay, so her wrist strengths are also very strong. Still full strength. Now we're gonna move on to her grip strength. Grip my fingers nice and hard as you can. There we go. Her grip strength is also full and equal bilaterally. Now we're gonna move on to her fingers. So spread your fingers out and don't let me push them in. Good. Very strong. I was not even able to budge her fingers at all. So those are also 5 out of 5. Okay, so next we're going to move on to her thumb strength. So you're going to do your thumb, like hook it to the finger, and I'm going to try to like move them apart. Very strong as well. 5 out of 5 strength. I wasn't able to part her thumb from her finger. Okay, so the rest of the exam is looking at your lower extremities. So I'm going to put my hand on your thigh, and I'm gonna have you push your thigh up, like against and then also like pull it down. So here, let me get the camera. Okay, now lift your thigh up. Good. Okay, now push your thigh down. Okay, good. Same on this side. Good, and then pull it down.